Hi, welcome everyone to our Cecilia Health webinar called Management of Chronic Kidney Disease. I'm Emily. I'm one of the dietitians and diabetes educators here with Cecilia Health. And our presenter today will be Wing, another dietitian as well. I'll introduce her here in just a second. And as always, this is an interactive program. The idea behind that is Wing is going to give a short presentation on the management of CKD. And then at the end, there is a time for question and answer. So if you have any questions or any comments at any point during the webinar, please go ahead and fill in your questions tab off to the right of the screen. Now, as always, we do know that the information you are about to hear may motivate you to make some lifestyle changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health registered dietitian will provide strategies to help manage your CKD, and this online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health registered dietitian. So today, like I said, I want to introduce Wing Lee. She is a registered dietitian as well as a kidney health coach. She has experience working with patients who have chronic kidney disease, cardiovascular disease, hypertension, weight issue, and diabetes for over 15 years. She lives in Southern California with her family and enjoys baking with her daughter, reading, hiking, and traveling with her family. So thank you all again for today, and thank you, Wing.
Thank you so much. So today we're going to be talking about management of CKD. We'll go through overall management of CKD, and we will be also looking at some kidney function tests and some additional tests. So our goal for the CKD is to delay or stop the progression of CKD. We want to treat the underlying condition, treat the comorbidities and complications, including diabetes, hypertension, hyperlipidemia, and anemia. And also, we'll be including planning long-term for kidney replacement, and that's for end-stage kidney disease. Now, regarding about the kidney function test, as your doctor may monitor your chronic kidney disease, they may be running some tests to see how your kidneys are functioning, and BUN is one of them. And so with the blood urea, nitrogen that's made from protein breakdown. And this level can vary, but high level usually means that your kidney aren't functioning normally. For the eGFR, which is we often talked about, is that it calculates the filtration rate based on your protein level, age, gender, size, and race. So GFR of less than 60 could indicate kidney disease. So you can see that between 50 to 60, that's indicate as chronic kidney disease. And the next one is creatinine. So we often see this one a lot on our lab work. So creatinine is the waste product in your blood that comes from your muscles. So healthy kidney, they filter creatinine out of your blood through your urine, and it helps to determine how kidneys are functioning. So there's two labs. One of them is urine, the other one is the blood serum creatinine. So with the urine one, it measures the amounts of creatinine in your urine. This number can go up and down depending on how your kidney is working. For the blood serum creatinine, it measures the amounts of creatinine in your blood. So this number can also goes up when your kidney aren't working well. So you can see the level is a little bit different between men and women. Now, for potassium phosphate and cholesterol triglycerides, these are the tests that we will be normally seeing with maybe a nephrologist, maybe all of them, so to see that how your kidneys are functioning. So when the kidneys are not working well, they lose the ability to filter fluids and electrolyte, and that can lead to a high level of potassium in your blood. So hyperkalemia is the medical term for the excessive high level of potassium, and normally it should be between 3 to 6 to 5.2. For phosphate, if you have chronic kidney disease, your kidney can remove phosphorus very well. So extra phosphorus can cause the body to pull calcium out of your bones and making them weak. So normally it should be between 2.8 to 4.5. And for cholesterol and triglycerides, though, this is the most common test for people that have cardiovascular disease with CKD, and the goal for the total cholesterol is less than 200, and for triglyceride is less than 150. Now, your healthcare provider, they may also order 24-hour urine tests. That's just to see if we have any protein in our urine. So this test is called albumin to creatinine ratio. So it stands for ACR. So basically, it's calculated by dividing the amounts of urine albumin by the amounts of urine creatinine. So the higher amounts of albumin in the urine can be a sign that your kidney aren't functioning well. And it should be less than 30 as normal. But if it's about 300, that means you severely increased albumin in your urine. So for microalbumin, when your kidney are damaged, they may let protein leak into your urine. So it causes high level of protein in your urine. So there's two types that they can do with the microalbumin. One of them is the random urine sample, which is usually 0 to 14, and another one is 24 hours. So they collect your urine in a 24-hour period, and the number should be less than 80. Now, for additional tests, EKG is the one that's testing for the heart condition. So it's recording the electrical signal from the heart to check for different heart conditions. The electrodes that are placed on the chest is to record the heart's electrical signals, which cause the heart to beat. Now the signals are shown as waves. So you will see some papers that say, oh, there's waves up and down. So there's waves that's showing on a computer monitor or printer. So you can see that for EKG. And that's for the heart conditions. And another test will be for glucose. And this is particularly important because for people that might be have diabetes, if they have chronic kidney disease, it's very important to manage their blood sugars. Since glucose is a type of sugar, it's also your main source of energy. So when your kidney aren't working right, urea can build up in the blood, and that can cause diabetes. So checking your blood sugar level will allow your healthcare provider to see if there's excess glucose in your blood. Now, for BMI, it's measuring your height and weight, and use that to calculate your BMI. So if your BMI is high, that can signal something. It's a screening tool for obesity, but it does not diagnose the health of an individual. I have members that they have higher BMI, but it could be also they were actually having muscles, and those it's including the weight. So a high BMI does not really means that you are obese. We have to also take into other factors as well. Now for blood pressure, normal blood pressure for an adult, it's less than 120/80. So people who have chronic kidney disease, a blood pressure of 130/80 or higher is considered high. So we would like to see the blood pressure being controlled for patients that have chronic kidney disease. So how to delay or stop the progression of the CKD? What can I do? So first, we can manage our health condition. such as if we have diabetes or if we have high blood pressure, it's important to control them to prevent further damage to the kidney. So ask your healthcare provider about your kidney health, such as you can ask them, oh, how is my EGFR, my creatinine, and my BUN, your lab tests, and how frequently you should be getting tested for these lab work. Early kidney disease may not have any symptoms at all. So it's good to look at your labs. And if you have questions, yeah, feel free to ask your doctor. Now, take medication as prescribed, but use caution. Use caution though with those over-the-counter pain medications such as ibuprofen or naproxen, because those can cause kidney damage. So it's very important to let your doctor know if you have been on some pain medication for a long time. Then they can let you know if that might be possibly cause some kidney damage. And also, if you have urinary tract infection, you want to see your doctors right away, because if it's being left untreated, it can cause kidney damage as well. Definitely making healthy food choices is very important for managing CKD. So choose a heart-healthy food such as fruits, either fresh or frozen vegetables. Frozen vegetables are totally fine. Whole grain, low-fat or fat-free dairy products, because that will be helping with the fat contents that we're getting from our food to manage our cholesterol, triglycerides. Also, we want to aim for less than 2,300 milligrams of sodium per day. That's about a teaspoon of salt right there. Limit added sugar to less than 10% of our daily calorie, because less sugar, less sugar, the better. And the reason is because we want to maintain our blood sugars, which is important for our kidney. And work with a dietitian to develop a meal plan. Now, being active is as important because it helps with blood circulations, it helps with cholesterol, your blood sugar, your blood pressure. So if you can be active for 30 minutes or more for most of the days and set out your goal, that would be great. More. Now, with the healthy weights, it's important to maintain a healthy weight. So you can speak with your doctor about what might look like for you. If you would utilize any free BMI calculator, that can be a tool for weight screening. Aim for 7 to 8 hours of sleep per night, because when you get enough sleep, your body is recuperating. It's important for the kidney health and overall health. Quit smoking. Um, so you can utilize, we have some free support resources such as with the National Quit Line, 1-800-QUIT NOW. If you're struggling with quitting smoking, this number can get access to this number for support, which is important. Alcohol. If you really must need to drink alcohol, limit to 1 drink per day if you're women, or 2 drinks per day if you're a man. But again, it will be good to limit alcohol intake. Focus on healthy ways to manage depression and stress. So there's this website, www.adaa.org. So it's a support group for anxiety and depression. So you can look up on this website. We also have an online support group for anxiety, and the website is www.anxietysocialnet.com. With being able to manage depression and stress, it's important because that can also add stress to your blood pressure. And so it's important to manage that condition and also treat underlying conditions. Now, treat underlying conditions for diabetes. And if you have diabetes, it will be important to check your blood sugar at home on a regular basis. Your blood sugar data can help your doctor to better see how your diabetes medication meeting your needs. And your numbers can help guide your decisions about what to eat or what trying to what should be avoiding and exercising, and so that is important for that reason. Um, and as your provider, how frequently to check and what are your target levels should be. So the 80 recommend goal of the blood sugars. If it's fasting with 80 to 130 milligram per deciliter in the morning and before meals, and for 2 hours after mealtime, it's recommended to be less than 180. So those are the number. So stay close to your daily blood sugar targets will help to meet your A1C goal, because your A1C level, it measures your average blood sugar over the last 3 months. So basically, if your number is less than 7%, for a person that have diabetes, is great. It's control with your blood sugar. Now for blood pressure, the most important step you can really treating the kidneys is to control your blood pressure, because it has a lot of effect on your kidney. So keep your blood pressure at or below your target can help protect your kidneys. So with CKD, again, the goal should be below 130/80. That would be the best. But also work with your provider, because they might have an individual blood pressure goal for you. And I know some people, they may just be remaining in 140s and 80s or 90s. So it really depending on you and your doctor to set up that bottom line to reach. And of course, taking medications would be important to manage your blood pressure. So if you're being prescribed with medication for blood pressure, communicate any issues with your doctors if you have any question, because this is an important thing to control your blood pressure. Of course, a heart healthy diet that's low in fat, low in sodiums, a lot of fruit and vegetable, higher fibers would be helpful. And also quit smoking and try to stay active and get enough sleep. Now for hyperlipidemia, which is we sometimes seems that we may be having elevated LDL cholesterol or high total cholesterol, or maybe even high triglyceride. So that's what we call hyperlipidemia. So to keep your lipid level in range is to help prevent heart attack and stroke. So that's important for the LDL not to build up and clog your blood vessel, because that can cause a heart attack or stroke if it's accumulated in your blood vessels. And so the HDL, which is we saying that's good cholesterol because it's helping to remove the LDL cholesterol from your blood vessel. So that's why it's a good thing if you're having a higher level of HDL. Triglycerides is also a blood fat that can elevate if you're eating too much carbohydrates or if you're eating too much fat. So we need to also pay attention to the triglycerides. Now, the ways to control blood lipids, there's a couple of things. Obviously, we're trying to get low with saturated fat. That also means that to limit animal fats from meat and high-fat dairy products such as whole milk or whole cheese that's made with whole milk. Avoid trans fats, and that's usually in a lot of fried food, fast food, and also processed baked goods. So stuff like with donuts um, and bakery stuff, croissants, and we're trying to limit those things because it can be really fatty and it has a lot of carbs in there. And also try to minimize concentrated sugar from sweet soda and juices. So if you see that, you see that there's high fructose corn syrup in your drinks or in some packaged food, those that typically have a lot of sugars in there and that affect your blood sugars and your lipids as well. So be aware if you look for something that you want to buy, be sure to check the ingredients. Be active 30 minutes or more per day. It's very helpful to exercise. We know that that's all we have to exercise, and even just go for walking 15, 10 minutes. And if you would like to spread them up in 2, 3 different times throughout the day, that's totally fine. The goal is trying to get ourselves being more active. High fiber food. So high fiber food like whole grains or legumes such as beans, peas, lentils are very helpful, not just with the lipids, but it's also good for blood pressure and for blood sugar as well. But for diabetes, we want to control the carbohydrate intake. Um, and choose healthy fat such as olive oil, nuts, seed, avocado, fatty fish like salmon and sardines. Those are good. Now take any medication if your healthcare provider saying that you might need to use medication to help with your lipids level. Um, then yes, that would be that you have to refer back to the doctor. Uh, and last is to monitor lipids in your blood test. This is usually being tested every 3 to 6 months, depending on your numbers. Now, with these complications of CKD, and often people with that would develop anemia. So the kidney makes the hormone, the EPO, and that tells your body to make red blood cell. So when you have kidney disease, your kidney cannot make enough EPO, which reduces your red blood cell count. And what it does is that the red blood cell carry the oxygen from your lungs to the rest of your body, which gives you energy that you need. So if the kidney is not functioning well and lead to anemia, that will make you feeling tired, and sometimes that can worsen and the kidney can fail. So symptoms, there's a couple of symptoms, but if you have anemia, which is can be including if you're have little energies and if you have poor appetite or feeling dizzy, headaches, or maybe having shortness of breath. So these are some of the symptoms that can be shown if you have anemia. How to test for that is to measure your hemoglobin level at least once a year as part of your blood test. And typically this should be also tested once a year. And again, hemoglobin is the part of red blood cell that carries oxygen throughout your body. So if you have this number low, you'll likely have anemia. So it would be important to talk to a doctor and to develop a treatment plan that's for you. How can it be treated? Your doctor may provide the following treatments, such as the ESA, and that is to help your body make red blood cell. And it's an injection that's being administered by your healthcare provider. Also, supplemental iron is needed because that is to help make red blood cell. So without enough iron, the treatment with the ESA won't be working as well. So your doctor may provide you an oral iron supplement, and they may also suggest receiving iron infusion as appropriate. Now, this is for the long-term. This is the planning for long-term kidney failure. So only for those patients that may have end-stage kidney disease. And usually that means that we have about 15% or less of the normal kidney function with the kidney failure. And at this level, there may be some extra fluid and waste products that's accumulated in the body. So there's a couple of options. One of the options is the dialysis, which including hemodialysis or peritoneal dialysis or kidney transplant. So with end-stage renal disease, is usually treated by either dialysis or the kidney transplant. So you can, if you have this condition, you can work with your healthcare provider to discuss what kind of options and the best plan for you that you think that is right for you. For kidney transplant, there are risks and benefits depending on factors like your age and if you may be having other health condition. So the first step is a transplant evaluation to determine if you're eligible for a kidney transplant. When it's time to start the evaluation process, the doctor will need to have dialysis within the next maybe 2 to 3 years. So work with your provider to set up an evaluation at a kidney transplant center is also one way as well. And after evaluation, you may be placed on the transplant list. Credit for waiting time begins when your GFR drops to 20 mil per minute or below. Now for transplant questions, so most of the transplant are successful with more than 90%. I'm sorry, success can increase if kidney transplant is performed before dialysis is needed. So this process requires a living kidney donor, such as a relative, spouse, or friend who agrees to donate a kidney. If you don't have a living donor, you'll be added to the national waiting list to receive a cadaver kidney from someone who has recently passed away. So transplant list is the waiting times can be long, and sometimes it can be years. So, but it's good to discuss these questions if you have any concerns with a trusted healthcare professional to develop a plan that's important for you. So that's it. I think if you have any questions, then again, thank you so much for coming to this session. And if you have any questions, feel free to use the toolbar and you can put the questions in there and we would like to answer your questions. And if you're interested in any of the upcoming live event, let your clinician know. We have a basics of chronic kidney disease in January, and in February we do have chronic kidney disease and cardiovascular disease. So be sure to sign up and ask your clinicians if you like this topic and like to join this live webinar.
Thank you so much, Wing, for presenting today. And like Wing said, please do talk to your educator if you're having more questions or wanting to know what did all this information mean for you. And they can kind of help break it down as well. As always, you can check us out on our website at Cecilia Health or also on our Facebook page as well. So thank you all again for joining us today. Thank you, Wing, and have a great rest of your day. Take care.